HIV and chlamydia are two sexually transmitted infections that affect millions globally. These infections often show no symptoms in their early stages, leading to their characterization as a silent epidemic. This silence can have serious consequences, as untreated STIs can lead to severe health complications. HIV, or human immunodeficiency virus, attacks the body's immune system, weakening its ability to fight off infections and diseases. Over time, if left untreated, HIV can lead to AIDS, a life-threatening condition. Chlamydia, caused by the bacterium Chlamydia trachomatis, is one of the most common STIs. It often presents no noticeable symptoms, especially in women, making it a significant public health concern. Untreated chlamydia can lead to pelvic inflammatory disease in women, potentially causing infertility. Understanding these infections, their transmission, and the importance of early detection and treatment is crucial for protecting ourselves and our partners. HIV is a complex virus that targets the body's CD4 cells, also known as T cells. These cells play a crucial role in the immune system, coordinating the body's defense against infections. When HIV enters the body, it attaches itself to these CD4 cells, using them to replicate and spread throughout the body. As HIV multiplies, it progressively damages and destroys the CD4 cells, weakening the immune system's ability to fight off infections. This process can take years, even decades, during which an infected individual may not experience any noticeable symptoms. However, as the virus continues to replicate and the CD4 cell count declines, the infected individual becomes increasingly vulnerable to opportunistic infections. These infections, which wouldn't typically affect a healthy individual, can cause serious illness and even death in someone with a weakened immune system. HIV transmission occurs when infected bodily fluids come into contact with the bloodstream or mucous membranes of another person. These fluids include blood, semen, vaginal fluids, rectal fluids, and breast milk. The most common modes of HIV transmission include unprotected sexual intercourse, whether vaginal, anal, or oral, with an infected partner, sharing needles or syringes contaminated with infected blood, often in the context of intravenous drug use, and transmission from mother to child during pregnancy, childbirth, or breastfeeding. It's important to note that HIV cannot be transmitted through casual contact such as hugging, shaking hands, sharing utensils, or using the same toilet. The virus cannot survive outside the body for long and is not spread through air, water, insects, or saliva. In the early stages of HIV infection, known as the acute phase, many individuals experience flu-like symptoms that can last anywhere from a few days to several weeks. These initial symptoms are often mistaken for a common cold or flu. These symptoms may include fever, headache, sore throat, swollen lymph nodes, fatigue, muscle aches, and rash. It's important to note that these symptoms can vary greatly from person to person. However, some individuals may not experience any noticeable symptoms during this early stage. This asymptomatic period can last for several years, during which the virus remains active in the body, during which the virus continues to replicate and damage the immune system. This ongoing damage can occur silently, without any outward signs. As the infection progresses and the CD4 cell count declines, more severe symptoms may develop, indicating that the immune system is becoming increasingly compromised, indicating a weakened immune system. These symptoms can include rapid weight loss, persistent diarrhea, sores in the mouth, genitals, or anus, pneumonia, skin rashes or infections, and memory problems. These symptoms are signs that the body is struggling to fight off infections. It's crucial to remember that experiencing these symptoms does not necessarily mean an individual has HIV. These symptoms can also be caused by other medical conditions. Therefore, it's essential to seek medical advice for an accurate diagnosis. The only way to determine HIV status is through testing. Regular testing is key to early detection and management of the virus. Section 5. Chlamydia, a common yet silent infection. Chlamydia is a bacterial infection that affects both men and women, often without causing any noticeable symptoms. It is spread through sexual contact with an infected partner and can have serious consequences if left untreated. The bacteria responsible for chlamydia, Chlamydia trachomatis, infect the mucous membranes of the reproductive system, including the cervix, urethra, rectum, and in some cases, the throat. Many individuals infected with chlamydia experience no symptoms at all, making it a silent infection that can go undetected for years. This asymptomatic nature of chlamydia contributes to its widespread prevalence and increases the risk of unknowingly transmitting the infection to others. Untreated chlamydia can have long-term health consequences, particularly for women. It can lead to pelvic inflammatory disease, a serious infection of the reproductive organs that can cause chronic pelvic pain, ectopic pregnancy, and infertility. Section 6. Transmission of chlamydia. Understanding the risks. Chlamydia is primarily transmitted through sexual contact with an infected partner. This includes vaginal intercourse, anal intercourse, and oral sex. The bacteria can be present in semen, pre-cum, vaginal fluids, and rectal fluids. Any contact between these fluids and the mucous membranes of the genitals, rectum, or throat can lead to infection. It's important to note that chlamydia can also be transmitted from mother to child during childbirth, potentially causing eye infections or pneumonia in the newborn. Chlamydia is not spread through casual contact. You cannot contract chlamydia from sharing utensils, hugging, kissing, or using the same toilet as an infected individual. Section 7. Identifying the symptoms of chlamydia. As mentioned earlier, chlamydia often presents no noticeable symptoms, especially in the early stages of infection. However, when symptoms do occur, they can vary between men and women. In women, chlamydia symptoms may include abnormal vaginal discharge, which may be yellow or green in color and have a strong odor, pain or burning sensation during urination, pain during intercourse, bleeding between periods, and pain in the lower abdomen. In men, chlamydia symptoms may include discharge from the penis, which may be clear, white, or cloudy, pain or burning sensation during urination, pain or swelling in one or both testicles, and rectal pain, discharge, or bleeding. It's important to reiterate that many individuals with chlamydia experience no symptoms at all. This highlights the importance of regular STI testing, especially if you are sexually active. Section 8. The importance of early testing and treatment. Early detection and treatment of both HIV and chlamydia are crucial for preventing serious health complications and stopping the spread of these infections. Timely intervention can make a significant difference in managing these conditions effectively. Regular STI testing is recommended for sexually active individuals, as it helps in early identification and treatment, especially those with multiple partners, as they are at a higher risk of contracting infections, or who engage in unprotected sex, which increases the likelihood of transmission. Testing is the only way to know for sure if you have an STI, as many infections can be asymptomatic and go unnoticed. As many infections can be asymptomatic, this means you might not show any symptoms but still carry the infection. Fortunately, both HIV and chlamydia are treatable infections. Early treatment can prevent long-term health issues. HIV treatment involves antiretroviral therapy, a combination of medications that suppress the virus's replication in the body, This therapy is essential for managing HIV. ART helps to control the infection, maintain a healthy immune system, prevent the progression to AIDS, and improve the quality of life for those living with HIV, and reduce the risk of transmitting the virus to others. This is crucial for public health. Chlamydia treatment typically involves a course of antibiotics, usually taken orally. These antibiotics are highly effective. It is essential to complete the full course of antibiotics as prescribed by a healthcare professional to ensure the infection is fully eradicated, even if symptoms improve or disappear before completing the medication. This helps prevent recurrence and resistance. Section 9. Prevention and Awareness, Key to Staying Healthy. Preventing HIV and chlamydia, and STIs in general, involves a combination of informed choices, responsible behavior, and open communication with sexual partners. It's crucial to stay educated and aware of the risks and preventive measures. Here are some essential prevention tips that everyone should follow to maintain their sexual health. Practice abstinence or be in a mutually monogamous relationship with a partner who has tested negative for STIs. This is one of the most effective ways to prevent transmission. Use condoms consistently and correctly every time you engage in sexual activity. Condoms are highly effective in reducing the risk of STIs when used properly. Limit your number of sexual partners. Having fewer partners decreases your risk of exposure to STIs. Get tested for STIs regularly, especially if you are sexually active. Early detection is key to effective treatment and preventing further spread. Talk openly and honestly with your partner about your sexual health and encourage them to get tested as well. Communication is vital for mutual safety. If you are living with HIV, adhere to your prescribed antiretroviral therapy to manage the infection and reduce the risk of transmission. Consistent medication can significantly improve quality of life. If you are diagnosed with an STI, inform your current and past sexual partners so they can get tested and treated if necessary. This helps prevent further spread and protects others. Awareness and education are paramount in the fight against STIs. Staying informed helps us make better decisions. By staying informed about HIV, chlamydia, and other STIs, we can make responsible choices to protect ourselves and our partners. Knowledge empowers us to take control of our health. Regular health checkups, including STI testing, should be an integral part of our healthcare routine. Early detection and treatment are crucial. Remember, knowledge is power when it comes to sexual health. Stay informed, stay safe, and take proactive steps to protect your well-being.